please join me in welcoming Monica Bryant. Monica Fawzy-Bryant is a cancer rights attorney and the co-founder and chief operating officer for Triage Cancer. Thank you, Monica, for joining us today. It's my pleasure to hand it over to you.
Thank you so much for having me. I'm delighted to be here to talk a little bit about health insurance, simplifying terms and choosing the right plan. So we'll see if technology works out for us today. So as was mentioned, my name is Monica Bryant. I'm a cancer rights attorney and co-founder of an organization called Triage Cancer. For those of you who might not be familiar, Triage Cancer is a national nonprofit that provides education on all of the legal and practical issues that can arise after a cancer diagnosis. And sometimes people wonder, well, what's legal about cancer? And the answer is actually almost everything. From what drugs are available for us to take, to what health insurance has to pay for, to what rights you might have at work, through disability insurance and estate planning and finances and everything in between. So I only have a little bit of time with you today. And so today's going to be a pretty high level overview around health insurance basics and how to pick a plan. But I just wanted to quickly mention that Triage Cancer can be a resource to you in addition to all of the wonderful resources that ZERO provides. At Triage Cancer, we host free educational events, both online and in person. We have educational materials in English and Spanish, animated videos, and I'll point you to some of those specific resources as we go along today. But sometimes when I do these sessions, especially in person, people will say to me, I'm ashamed to say that I don't really understand how health insurance works in this country. And if you are feeling any inkling of that, I want to assure you that you are definitely not alone. In fact, studies have shown that 96% of Americans don't even understand the four most basic terms that are used in health insurance. Because understanding health insurance is like learning a new language, but rarely are we ever taught that language. And so the reason I'm starting with this is, if we don't understand the words that are being used, how can we possibly be savvy consumers of health insurance? And that's why I really want to start with some basics and some terms. In the United States, there are 3 places where we get health insurance. About 50% of Americans get their health insurance through an employer. Millions of Americans get their insurance through the government, primarily through Medicare and Medicaid. And then there are some people that go directly to an insurance company to purchase their health insurance. But regardless of where you fall in terms of your insurance coverage on what we refer to as our triangle of coverage, there are terms that are used across all of these different things. And first, the terms related to cost. There is a cost just to have the health insurance, and that's your monthly premium. And you're going to pay that monthly premium whether you go to the doctor or not. It's very similar to having car insurance all year, but never getting into an accident and filing a claim. But in addition to your monthly premium, there may be added costs when you actually go and use your health insurance. The first is your annual deductible, which is a fixed dollar amount that represents what you have to pay first out of pocket before your health insurance kicks in. That fixed dollar amount is going to depend on the policy. You could have a $500 deductible, you could have a $5,000 deductible. But again, it represents what you have to pay first before your health insurance kicks in. And once your health insurance kicks in, then you are going to share the cost of your medical care with the insurance company. And that's referred to as your co-insurance or your cost share. And this is a percentage. And you're going to pay that percentage of the cost each time you get care. Some plans have an additional payment called a copayment. Again, this is a fixed dollar amount that could depend on the service you're getting, can depend on the plan you're getting, but it could also depend on the service you're getting. So it's very common to have a structure like every time you go to see your primary care physician, you pay $20. But if you go and see a specialist, you're going to pay $30. And if you end up in the ER, you're going to pay $250. It's a fixed dollar amount based on service. It is absolutely possible to have both a co-insurance and a co-payment for the same service. One of the most helpful things for everybody to understand about their health insurance is if there's an out-of-pocket maximum and how much is that out-of-pocket maximum. Because the out-of-pocket maximum is a fixed dollar amount that represents the most you are going to pay out of pocket when you use your healthcare. And the way that you get to your out-of-pocket maximum is a math problem. So it could be that you're going to add up everything you pay towards your deductible, everything you pay in co-payments, and everything you pay in co-insurance. So it's everything you're paying out of pocket except that monthly premium. To give you an example of how all of this might work, I'd like you to meet Dan. Dan has a plan with a $2,000 deductible. It's an 80/20 co-insurance, and he has an $8,000 out-of-pocket maximum. Dan hasn't gone to the doctor yet this year, but what he experiences is an accident and ends up spending a week in the hospital, and that results in a $102,000 hospital bill. So what does Dan actually have to pay? Well, the first thing we always have to pay is that deductible. And once he pays that, there's $100,000 left in his bill. Now that he's met his deductible, his co-insurance is going to kick in, where the insurance company is going to cover 80% and he's responsible for 20%. 20% of $100,000 is $20,000. But how much of that $20,000 does Dan have to pay? And this is where it can get confusing for people. Because Dan has the out-of-pocket maximum of $8,000 and he's already paid $2,000 towards his deductible, he only has to pay another $6,000 to meet that $8,000 out-of-pocket maximum. And then for the rest of the year, no matter what medical care he gets, that's going to be covered at 100%, and all he will have to pay are those monthly premiums. So I'm certainly not sitting here suggesting that $8,000 isn't a lot of money, because of course it is. But when we start to understand an out-of-pocket maximum and what it would mean if we didn't have the out-of-pocket maximums, he would have to pay $22,000. Certainly what it would mean if he didn't have health insurance at all. Starts to feel slightly more reasonable. If you would like to hear any of that again, the terms that I just described or this example, or you think there's somebody in your life that could benefit from learning that, we have it included in one of our animated videos on health insurance basics that can be found on triagecancer.org. Now, unfortunately, in my line of work, things are rarely ever this simple because the devil is often in the details. And that is certainly true when we talk about out-of-pocket maximums. Because there could be a situation where someone has an out-of-pocket maximum for in-network services and one for out-of-network services. If someone has a family plan with multiple members of the family on the plan, they could have both an individual out-of-pocket maximum, but then also a family out-of-pocket maximum. If someone has gone and purchased their own health insurance through the state health insurance marketplace, then the math problem I gave you earlier is what the marketplace has to use. So everything you're paying towards your deductibles, your co-payments, and your co-insurance. But if you have an employer plan, the math problem can be a little bit different because employers are entitled to create their own math problem. So some employers might not include deductibles in your out-of-pocket maximum. Some might not include deductibles or co-payments, so they're only including your co-insurance. Sometimes they have a separate out-of-pocket maximum for prescription drugs. So if you get your insurance anywhere but the state health insurance marketplace, it is really important to know not just the dollar figure of your out-of-pocket maximum, but also what's the math problem. There are certain times of year that we get to perhaps enroll for the first time in health insurance or make changes. And that time period is different depending on where you get your health insurance. If you have an employer plan, again, they can pick their open enrollment period, but many employers will pick a fall timeframe to coincide with the calendar year. Medicaid applications are accepted year-round, and Marketplace has open enrollment between October 15th and December 7th every year. For Marketplace plans, in the past, open enrollment has been from November 1st through January 15th. However, there have been reports that for this coming year, that might be a shortened timeframe. Marketplace plan and Medicare are calendar year plans, which means that even if someone picks a plan day 1 of open enrollment, the first day that plan can start is January 1st. Thankfully, our system recognizes that things don't just change with respect to health insurance coverage during open enrollment. So with every type of plan, there is also something called a special enrollment period, where if you are losing coverage, like you are leaving your job or you're moving to a new state, and so your coverage is going to end, then you can enroll in new coverage mid-year. So that's great news, and it's great news that we have more options than we ever had in the past, but how do we actually make choices between those options? I'm going to walk through an example using the state health insurance marketplaces, but know that this same thought process and analysis can be used when you're trying to compare marketplace plans, or perhaps you're offered more than one plan from an employer, or even if you're trying to compare Medicare Advantage plans. So if you were to go to healthcare.gov/C-plans, you could actually window shop your health insurance. And so the system would ask you for some basic information like your zip code, your household size, your income level, and your age. And then based on that information, you would see a screen similar to this one. It changes every year, so it's not exactly the same anymore. But it allows you to see key information related to those terms I just talked about, to be able to decide or understand if the plan is going to meet your needs and what it's actually going to cost you. So from here, you can see that my fictitious person that I included has 33 different plans. That's a lot to sort through. So then the marketplace allows us to continue filtering out based on a variety of factors. So maybe you only want a monthly premium between a certain dollar figure, or you only want a certain level of plan, or maybe you're really specific about the insurance company you do or don't purchase from. Maybe you want to make sure that you're getting a PPO versus an HMO. So this system allows us to sort the information, much like we've become familiar to in other ways when we shop. So once I do all of that, I now need to understand, okay, which plan is actually going to make the most sense for me? So like I said, analysis can be used for many different scenarios. It is not just about marketplace plans, but anytime you're being offered more than one plan and you're trying to decide which plan might cost me the least at the end of the year. So here I'm looking at 3 different plans. And the first plan has a $200 a month premium with an $8,000 out-of-pocket maximum. A silver plan with $275 a month with a $6,000 out-of-pocket maximum. And a platinum plan at $400 a month with a $2,000 out-of-pocket maximum. And I want to know, in a worst case scenario, assuming I'm going to hit my out-of-pocket maximum, which is pretty likely in the case of a cancer diagnosis and treatment, which plan is going to cost me the least at the end of the year? Can I figure it out just by looking at this screen? That is absolutely a trick question because the answer is no. You cannot do it just by looking at the screen. You do, in fact, have to do the math. And the way you do the math is you take your monthly premium and multiply it by 12, and then you add the out-of-pocket maximum. And when you do that, excuse me, when you do that for all 3 plans, monthly premium times 12 plus the out-of-pocket maximum, you see that that Platinum plan at $400 a month actually ends up being, excuse me, that Platinum plan actually ends up being less expensive at the end of the year. Give me just one moment. I'm so sorry. Very inopportune time to have a coughing fit. Now, most people, when they're looking at this, only look at that monthly premium, and then they get sticker shock and they think, well, why would I pay $400 a month when I could just pay $200? And that goes back to not understanding the terms that I started with. If you don't understand what an out-of-pocket maximum is, you wouldn't even know to do this math. But of course, that final number is only one piece of the puzzle. You also want to look at the other costs. So for the deductible, for example, some plans might be cheaper at the end of the year, but might have a huge deductible. And if you remember, the deductible is the first thing that you have to pay. So it might make more sense to pay a little bit more each month with premiums and have a lower deductible so that you're not having to come up with a big lump sum at the beginning of the year. That's really going to be very dependent on each person's situation and ability to pay that deductible. Also, most of the time, the out-of-pocket maximum is only going to count towards in-network providers and facilities. So before picking a plan based on it having the lowest total annual cost, you want to double check that all of your providers, hospitals, labs, imaging centers, are included in that plan's network. Similarly, if you are taking prescription drugs, you want to make sure that any prescription drugs are included on the formulary for that plan. The marketplace gives us some tools to do this. However, I always recommend that you confirm with the insurance company that the providers and formularies are correct and that you double check with your employers. Now, I definitely don't think that you should go in and say things like, do you take a marketplace plan or do you take Obamacare? Because inevitably the answer is going to be no. So make sure you're using the specific plan names when you are asking if the provider takes that insurance. Do you take X insurance company, blue, gold, 100? It is really helpful also to let your provider know ahead of time that you are switching plans so that they can help smooth the transition. Now, we at Triage Cancer have a couple of tools to help you make choices between your insurance options. We have an animated video on picking a plan. We also have this worksheet that you can print out for free that you can actually write into, and it'll help you do that math that I just described. And hot off the presses, in addition to the printable worksheet, we now have an online calculator that you can use. So you can go to our website, put the information in about the plans you are considering, and the calculator will do the math for you. Once you've done that, you can hit print and print your results if you'd like to. So all of that is available on triagecancer.org. Now, in our last couple of minutes, I did just want to make sure that I hit on some new changes that we have this year, specifically related to Medicare. So Medicare Part D is the part of Medicare that covers prescription drugs. These plans are sold by private insurance companies, so the costs can vary from plan to plan. Maximum in Part D plans. And so people who are taking expensive prescription drugs oftentimes struggled to pay for those expensive prescription drugs. So we have a significant change this year, and I want to walk you through how coverage works in Part D. Excuse me. So the first thing we always have to pay is that annual deductible. This year, it can't be more than $590. Once you've paid that for your prescription drugs, you enter the initial coverage phase. And this is where you are going to pay 25% of your prescription drug costs until you have paid a total of $2,000 out of pocket. Then you enter the catastrophic coverage phase, where you are no longer responsible for paying for your prescription drugs. This is incredibly significant and a huge change that we saw thanks to the Inflation Reduction Act that was passed in 2022. While this out-of-pocket maximum of $2,000 is incredibly helpful to keep costs down, when you think about who receives Medicare, which is individuals who are over 65 and often have fixed incomes, or people with disabilities so severe they cannot work and they are receiving Social Security disability insurance for 2 years, even $2,000 can be hard to manage because sometimes it's one prescription that gets you to that $2,000 mark. So the Inflation Reduction Act also created a Medicare prescription payment plan. This is exactly what it sounds like. It's a payment plan. It's a way to spread out your costs throughout the year so that you don't have to pay the $2,000 in one lump sum. There's no interest, it's voluntary. You can sign up, and if you decide you don't like it, you can withdraw from it. If you sign up, then you don't pay anything when you go to the pharmacy to pick up your drugs, but rather the insurance company that you purchase your Part D plan from will send you one bill for your premium and one bill for whatever your payment is on the payment plan. To give you a very quick example of what this looks like, Julie has an out-of-pocket cost of $600 at the pharmacy each month. If she's not in the payment plan, then she pays $600 in January, February, and March. In April, she only has to pay $200 because that's what gets her to her $2,000 cap. But if she chose to enroll in the payment plan, you can see that instead of having to pay $600 in January, she only has to pay $167. And the math is a little bit complicated, but I really just want you to walk away with the idea that this payment plan is simply a way to smooth or spread out your prescription drug costs throughout the year. I couldn't leave today without giving you that updated information for this year. But given that this was such a short amount of time together, I did just want to share that if you are interested in learning more about cancer-related legal issues, we would love for you to join us at our annual conferences, which are free and online. We also have monthly webinars, including 2 on Medicare towards the end of the year, if that's something you'd like to learn more about. But we also have webinars on a variety of other topics as well. Registration for all of those events is available on our website. And finally, we know that even with all the resources we create and videos and events that we host, people still have questions about how the law applies to their specific situation. In those instances, they can reach out to us via our legal and financial navigation program by completing an intake form on our website at triagecancer.org. Get help. So thank you so much for joining us today. And I'd be, I welcome any questions if there are any.
Thank you so much, Monica. That was an incredibly informative presentation, and I really appreciate it. I know we're giving folks a minute to see if they want to add any questions into the chat, but in the meantime, I think we have a poll question to ask folks, a brief poll to gather everyone's feedback on this session. We'll leave this open for just a moment here. It tells Monica and I we can't vote, so I don't know how long it takes. But do feel free to also go ahead and add any questions in the Q&A function if you would like. All right, we'll give folks about 10 more seconds. There goes the poll. Monica, you were so incredibly informative.
Oh, thank you.
I take that back. I've got one question.
Okay.
So does Triage provide help with insurance denials? Is that something that you guys can help with?
So as an educational organization, we don't provide direct legal representation, but our goal is really to educate people about the process and the practical steps that they need to take in order to get what it is they need. And so when people come to us with questions about insurance denials, we absolutely will walk them through their various options and also the steps, because those steps are going to depend on the type of insurance somebody has. We do have some suggestions of where people can go to get hands-on help if they need help with things like applications or denials. But to be perfectly honest, when it comes to denials, your healthcare providers are your biggest ally because they're really going to be the ones that can help you gather the evidence that you need to make your case with the insurance company.
Thank you. I appreciate that.
Absolutely.
Going once, going twice, we're going to give people about a minute and a half to go back into the auditorium and head to their next session. Thank you so much to everyone for joining us for this session. And thank you to the sponsors of our virtual summit, Foundation Medicine, Bayer, and Blue Earth Diagnostics. Please return to the auditorium and the event platform and join the next session. Have a great day.